Yeah, we can sort of start now. So again, what when we look at mindfulness, I hope my screen is visible. Can someone just give me a thumbs up so I know that uh, is it changing? Okay, thank you so much. Thank you. So using mindfulness in counseling, when we look at mindfulness, it basically means that we are paying attention in a very particular way, right, on purpose. So usually what happens in sessions is sometimes our clients or the students that we are working with, they might be going through something. They might have that a lot of pressure that's sort of letting out, a lot of catharsis that's happening, right, in our sessions when we are doing counseling sessions. So sometimes they might sort of keep going on and on and on. They might sort of forget where they started, and they might sort of lose the sense of consciousness from where they started this topic, how it's gone. So when we talk about mindfulness, we are paying attention, bringing them back to the present moment, and very intentionally to the present, right, and very non-judgmentally. We're not judging them because they're going on and on and on, but we're like, hey, listen, I know that you had this very cathartic moment, but let's come back and let's ground ourselves to the present, right? So it's a very meaningful way to pay attention in a very particular way on purpose, and in the present moment, a very non-judgmental, right? So John Kabat-Zinn was one of the pioneers, and they have a lot of research that they have done in the field of mindfulness and how it can help in our counseling sessions, right? So when we look at mindfulness, why is it important for school counselors, right? So children these days are facing a lot of anxiety related. I mean, it's not just these days. I think it's been there when I was a student, when we all were students, right? There were different things that have been causing anxiety. It could be academic pressure, it could be the overstimulation, it could be just a lot of transitionary challenges that they are facing, right? Moving from, say, the house, the primary school to middle school to high school, a lot of uncertainty about how the world is going on right now. So a lot of overstimulation and a lot of academic pressure, a lot of other pressures as well, right? So when we are working with students, we are basically anchors to them, where we can provide certain grounding tools for them, right? And we've when the CDC has done a research around reporting that anxiety and a lot of depressive symptoms in school age children is increased post pandemic, right? So some of the reasons that we can think of why these cases have increased is maybe because of sort of staying there, a lot of changes, a lot of uncertainty that happened during the pandemic. We look at the social world that we are living in right now, right? A lot of changes, right? With the boom of AI, we don't know, right? We're studying to become something, but will our job even exist, right? So these are some simple examples that I'm giving, that when I'm working with students, right, especially teens who are preparing for their boards or preparing for their NEET exam, their whatever the exams that are happening for students, and they're reporting high cases of anxiety, right, because they don't know where the world is going towards. And because of this, there's a lot of anxiety, there's sort of just general tension that students are feeling, right? And it's something that I think we are also working with students are very well aware of, right? So using mindfulness in our practice can also help students gain attention or gain knowledge of their own, to coming back to the present moment when, say, they are sort of spiraling into their own anxiety. uh, One second. So when we're looking at understanding mindfulness, what are the components of mindfulness, right? So mindfulness is very much focused on the present moment, right? We're not looking at the past, we're not looking at the future. We're like, how do we bring our client back to the present moment, right? And it's a very non-judgmental observation, right? Whatever they're feeling, being a very non-judgmental through it, and also accepting of the thoughts and the emotions, right? Whatever emotions they're feeling at that present moment, or whatever thoughts they're going through at that moment, right? So when we look at mindfulness, say if you're starting off the session, grounding your client to the present, right? They might be going through their whole day, different classes, and post the lunch break, they're coming to you for a session, right? They might have gone through so much, so immediately they'll come to the session and they'll be like, this happened in class today, first period math, this happened, then I had this English exam, then I had so much happening, and my friend, I had a fight with my friend. So they come and start telling you. So you tell them, hey, let us ground ourselves to the present moment. What's happening, what are the thoughts that's running in your mind? And most of the times, or sometimes it could be positive emotions, like I'm very excited to be in the session, but sometimes they might be like, I'm not in the mood today for session, and that's what I'm feeling right now. I'm feeling very tired, I'm feeling very lethargic. But that's okay, right? We're accepting the client, we're accepting the student as they are coming to us on that particular day. So these are the main components, right? It's focused very much on the present, it's very non-judgmental, and it is the acceptance of any thought and emotion, right? So when we look at different forms of meditation, we could see the formal sense, that there is meditation and the guided exercises, and the informal mindfulness where it is more of walking or breathing before exams. All of those breathing techniques, the walking, all of that is considered as informal. But when we look at formal, it is mostly meditation and guided exercises where it is done with a specific intention, right? There is specific steps. So for example, JPMR is a very formal form of mindfulness, because it is progressively you're relaxing every muscle. There are certain steps that needs to be followed, with meditation as well, with guided exercises. But with informal, the client is in control, right? They can walk at whatever pace they want. The breathing also can be in terms of whatever technique the client wants to use, right? So before we understand mindfulness and how we can use it in our practice, let us sort of look at the theoretical foundation, right? In psychology, how did mindfulness become a very big practice, right? When we look at psychology, when we look at therapy, most of the therapies focus on either understanding the past, or focusing on, okay, let's find a solution to your problem, when we look at SFPT and all of those techniques. But what are the theoretical foundation of mindfulness, and how did that get inculcated into the psychological or the therapeutic practice, right? So when we look at Buddhist psychology, that is that is where sort of mindfulness as a concept originated, right? It's a very alternative practice, very alternative healing. So from Buddhist psychology, it originated from a lot of Eastern contemplative traditions. Right, so when you look at Japanese culture, when you look at a lot of Eastern cultures, we can see that mindfulness is a very innate practice in the culture. Right, it's something that they do on a day-to-day basis, right? They're not training for it, it's something that is passed down from generations. But it was sort of integrated into the Western psychotherapy through the work of John Kabat-Zinn in the 1990s. So very recently, in the technique that is called as the MSBR, which is the mindful based stress reduction technique. We'll come to what MSBR is. So in the 1990s was when these Buddhist philosophies of meditation and mindfulness sort of originated, and that was sort of integrated into Western psychology. And when we look at third wave CBT models, right? So third wave CBT models is post, like we can sort of tell them as the more postmodern therapy techniques, right? So in those postmodern therapy techniques, we can see most techniques uh, center mindfulness as a very important therapeutic intervention, right? So when you look at ACT, which is the acceptance commitment therapy, in DBT and in MBCT, these are techniques that focus on the mindfulness aspect a lot, right? And even in the person-centered approach, we can see that Carl Rogers specifically spoke about presence, about empathy, and congruence, right? For the therapist, not for the client, but for the therapist, which is all cultivated through mindfulness, right? So again, mindfulness is not a one-way street. It's not just a client who has to be mindful, but I think as a therapist, we also have to have a lot of mindfulness practices in our day-to-day routine, right? um, so the core components of mindfulness in counseling are, one is the intention, right? So when you are practicing this mindfulness, or you're using some technique from the mindfulness, techniques, what is the intention behind it, right? You can't simply just keep bringing the client back into the present moment. Like if the client is sharing, and then while you can't stop the client and be like, come back to the present, right? We have to let, what is the intention of us using this particular technique, right? Do we feel that our client is very overwhelmed? Do we feel like they're going out of track? Do we feel like, do we feel like their nervous system is not regulated? Do we feel like we might be triggering them more, right? By a certain question that we might have asked, or a certain something that we might have done to maybe overstimulate the client, right? So the intention of doing the mindfulness is very important. We need to understand that we are using this also to gain insight about the client, right? So when we are asking them to calm down and ask them what their thoughts are in the present moment, we are not just doing it for them to calm down, we're also trying to gain insight of what is going on in the student's mind or in the client's mind, right? Next is the attention that we are paying, right? So the present moment awareness, is our client aware of what they are experiencing in the room, right? So when we tell them to close their eyes and bring their senses into the present moment, so we ask them, what are the five things that you see or the four things that you are hearing. So we are bringing them into that awareness. So we are also checking if are they aware in the right sense, right? Sometimes we look at clients with say very like clinical challenges, right? Clients who might have schizophrenia or clients who might be having paranoid delusions. There we might notice that they might not be hearing the same things that we are, or they might be not be seeing the same things that we are. So we're also paying attention to the client's reality in that moment, right? So the present moment awareness of the inner and outer experiences of the child, right? And also the attitude. We are again approaching this technique when we are asking the child to be mindful. We are approaching this experience with openness, right? We are also exploring it with curiosity and compassion, right? So sometimes what will happen if a client is resisting a lot, the second you tell them to be mindful, it's a very scary space for them to be in, right? Because they have done so much to dysregulate their thoughts or be in touch with their thoughts. But the second we tell them, hey listen, we are going to be mindful, right? We are going to focus on our thoughts, we're going to focus on our emotions, immediately there might be resistance from the client, especially if the rapport is not built, because they might feel that it's a very unsafe space for them to speak of their thoughts or speak of their feelings, right? So when we are approaching it is to not be resistant with them, or sort of be rude telling that, hey no, tell me what you're thinking. If the giving the client that space to, hey, can you tell me, are you opening to tell me what you are thinking right now, while you are doing the mindful practice, right? So approaching any experience the client is feeling with openness, curiosity and compassion is very important, right? So these are some of the core components of mindfulness therapy, right? So there are I was talking about the postmodern practices. So mindfulness based stress reduction is one very significant technique or a significant intervention approach, like CBT, ACT, or DBT, that specifically has mindfulness as the core component, right? So this was founded by John Kabat-Zinn, and the primary use is in medical and mental health populations to deal with stress, anxiety, and chronic pain. Right, so these were the population that he had used these techniques in. But the key features are it's a very structured group program. So this is mostly works in a group setting, and it incorporates a lot of techniques like the body scan, sitting meditation, and mindful movement. So it takes a lot from the Buddhist philosophies, from a lot of Eastern and postmodern techniques, right? So since he did study a lot about the Buddhist philosophy, a lot of techniques seem to come from those schools of thought, right? And again, it emphasizes on the non-judgmental awareness of the present movement, right? Moment. So when we look at it, how can we use this in our schools or in our therapy setup? Is to one, for helping the client to respond to the stress rather than react to it, right? So if the client is feeling stressed at the during the session, or if they are experiencing stress, rather than reacting to it with a lot of anger, with a lot of sadness, or with a lot of you know uh, and angry provoking emotions, we can help with the how can we help the client respond to that emotion, right? Again, stress is a very significant feeling. So rather than reacting to the stress by getting more stressed, or like by getting more hyper, how can we get the client to first calm down? Because when you are stressed, you cannot function at a normal pace, right? So first we need to teach the client that, hey, you need to come to a homeostasis, to the middle ground, and then we can respond. And to come to that middle ground, mindfulness will help you, right? So teaching them, and again, mindfulness techniques does not happen where we teach them once and it's whenever they feel stressed they can use it. It's not like that. We have to constantly, it has to be a practice in their day-to-day life, right? It has to be part of their routine. So meditation, body scanning, this is something that they have to do when they're not stressed as well, right? So that your body is aware that okay, when I'm stressed I can use this technique, or I can use this to help myself, right? Even with JPMR, the first time or the second time that you do JPMR, you might not necessarily feel the benefits of it, right? And then you might be like, okay, this doesn't help me that much. But from what I have learned, it's that JPMR has to be done on a day-to-day basis until your body is aware that I'm doing this to calm myself, right? And then when we are feeling stressed, eventually we are able to respond to it, so by bringing ourselves to a calmer position, right? It also builds attention regulation and emotional resilience, right? So when we look at mindfulness, it is not telling us that hey, this is the solution to our problem, but rather we are able to regulate our emotions, right? We are able to bring that the stress level from a 10 to a 5, right? And we know that maybe if we bring it to a 4, we can handle whatever is making us feel stressed, right? So it builds attention regulation and emotional resilience, because again it helps. When we learn these techniques, we know that even no matter how stressed we are, we can reach out to this to find support for our body, right? It is like, our body knows that this is something that will help me calm down. No matter what happens, if I do XYZ, it will help me calm down. And also encourages a lot of self kindness and reduce identification with distressing thoughts, right? So again, because we are able to mindfully bring our, so when we are stressed, I think our thoughts spiral into a, where there's a lot of negative self perception, right? Say we are stressed because of an exam. When we are already stressed to say a level 9, and we are not able to study the particular math problem because we are stressed, so we're not able to focus, our attention is all in back, right? So and then what will happen if you're not getting that problem or the sum right? Immediately your thought will go into, oh my god, I suck, or I am the dumb one, or I am the one that's not getting this. And the immediately the thought at a, when you are stressed at to say a level 9, your thoughts immediately go back into a lot of self-hating, a lot of negative, self-hating thoughts. But when we are able to mindfully bring ourselves from that stressor to a 4 or a 5, we are able to practice self-kindness, we are able to give ourselves that space to breathe. And then we're able to realize that the problem is the problem, we are not the problem because of it. There's a lot of self-kindness, and a lot of we're able to reduce the uh, identification with these distressing thoughts. We're able to think more clearly. I think the clarity is what mindfulness brings into your day-to-day practice, right? So this is mindfulness based stress reduction. And then similar to that, we also have the MBCT, which is a mindfulness based cognitive therapy. So this is similar to that, to the mindfulness based stress reduction technique. But here they're accompanying, or combining the CBT techniques into mindfulness. So I feel like this is a little more cohesive, or a little bit more comprehensive, and it's more I think works better with the student population, because it's not only focusing on mindfulness, but also focusing on how do we shift the thought pattern. So I think it's doing a very two-in-one mechanism, which I feel really helps. And personally, I have also used techniques from this particular therapeutic strategy, that has I've seen help with clients, because it's more structured, right? Because I think CBT is structured in a very beautiful way, which really helps students. So I think with that, when we include mindfulness, I feel like it is sort of like a win-win to the student that we are working with, right? So the founders of this particular technique are Zindel Siegel, Mark Williams, and John Teasdale. Again, this is just, I don't know, a fact or a tidbit. And the primary use is specifically with clients with major depressive disorder, or in relapse prevention, in depression, or even with substance abuse, right? So this was the primary population that this was used in. But with students as well, I found that there is a lot of scope for this to work, right? So here it basically combines MSBR and CBT. They basically use decentering. So it is teaching the clients to observe the thought rather than believing it or following them, right? So again, thoughts are just how our mind is communicating with us, right? So whether we are not telling the client that you have to follow or believe the thought, because sometimes thoughts can be self-deprecating, or the thoughts can be harmful to the self, right? Especially when the client is depressed, or when the client is going through depression, or clients with bipolar issues, right? So telling them to decenter their thoughts and sort of look at it as just a voice that's just telling them things, rather than not believing it, and focus on the early detection of thought patterns. So basically, when they feel that okay, their thought pattern is going to a certain way where they're feeling it's a more self-deprecating, or it's more harmful to the self, or they feel like the thoughts are getting a little more dangerous to themselves, especially in terms of self-harm or suicidal ideation. So then we are able to detect the thoughts, because we are telling the clients to sort of be in attention with their thoughts, which is what CBT tells you, right? And then we're also teaching the client to decenter from that particular thought. So here the core strategies or the core techniques that came out of MBCT was thought labeling. This is just a thought, not a fact. Basically telling them to sort of listen, sort of look at the thought from a very objective perspective. Is this something that's helping me, or is this something that's not, right? And then using it is just a thought, not a fact. Again, mindful breathing to disregard, to disengage from rumination, right? Again, ruminating is what leads to depression. So sort of mindful, so here when they are feeling that space to ruminate, to calm, to then bring in mindfulness, right? So that again, we are again making that, we are forming a pattern. So every time the rumination happens, when we bring in mindfulness, right, then immediately the ruminating or the spiral sort of stops, or the spiral reduces, and they're able to get out of it before they get in too deep, right? And again, body scan to connect the mind from the body. So we know sometimes a lot of clients that I have worked with, at least a lot of teens, a lot of adults, I've noticed that a lot of their thoughts also spiral from the kind of food that they've eaten, if they've eaten or not, if they've slept. So if a client has good sleep, they generally have more or less their thoughts are stable. But then say they have missed a day of sleep, then you can notice that the thoughts are a little more going towards the side of rumination, right? So always having that body and mind connection, right? Doing a body scan, checking how our body is feeling, how each part of our body is feeling. Have we not eaten, have we not slept, have we not exercised for a while, is that why we are feeling this way? So sort of having that mind body connection is something that MBCT also brought in. So then the next therapy technique, and the reason I'm bringing up these techniques or bringing up the particular names is so that you can read up about it a little more. This is a 1 hour webinar, so I can't really cover everything to the whole. But if you sort of find books about this, find books about these techniques, they have a lot of resources that you can use, right? A lot of intervention strategies, a lot of ways that you can use these techniques into your practice however you feel like it. So again, ACT or acceptance and commitment therapy is another very I think useful technique. So this one was founded by Stephen Hayes, and primary uses anxiety, depression, chronic pain, and trauma, right? So the core philosophy is psychological flexibility is the goal, right? So to be open, to be aware, and to be actively engaged in your life, and in a very value driven life. So here it is, we are sort of helping the client build or center their own values, right? Because growing up, we know that we sort of pull in from different parts. So what are the social values that we need to learn, what are the values that is being taught at home, right? A child from a tier 1 city to a child from a tier 2 city have different values that they're grown up with, right? In their life. So everybody's value systems are very different. We sort of been thrown a lot of things that we're supposed to follow. But in ACT, what we do, or we give that independence for the client, where we ask them to be flexible with their with their psychology, with a lot of psychological flexibility. And I think the very important, I would say, mission for anybody when we look at self acceptance, when we look at positive mental health or positive emotional intelligence, is the main core philosophy is to have a sense of flexibility, to be open minded, right? Rather than being very rigid with your thoughts and rigid with your values, to be open, to be aware, to be actively engaging with people around you and with yourself, and constantly being open to new things, open to change, right? And also here we are using mindfulness in ACT therapy specifically to accept our inner experiences, right? And to commit to meaningful action. So here mindful breathing while labeling the thoughts. So when the thoughts come in and we're trying to label them, sometimes labeling does happen, right? Like when we are having our thoughts, we're like, oh, this is a negative thought or this is a positive thought, and that might cause us some anxiety, right? So mindful breathing when we are labeling the thoughts, and noticing and naming the experience. So using the feelings wheel. So again, using the feelings wheel can also be used as a mindfulness practice, because there we are labeling the specific emotion that we are feeling, right? So we're giving it a name, we're giving it a perspective, right? This x incident made me feel by way, right? So noticing and naming those emotional experiences. So when we look at very quickly the key components of ACT is the cognitive diffusion, basically detaching from your thoughts, similar to the the previous thing where we are detaching from our thoughts and looking at it from a very objective perspective. Acceptance, making space for uncomfortable emotions, also contact with the present moment, right? While we are making acceptance, we're also bringing ourselves back to the present moment, and using the self as the context, and having a clear value system, and having committed action, right? Basically that we are moving forward, a lot of intentional, right? When we look at mindfulness and ACT, the very important thing is that the intention matters to anything. Intention of the thought, intention of the emotion, whatever intention of whatever is happening, the intention is very important. Grounding, right? Clarity, and again detaching from your thought, right? Rather than thinking of it as fact, just thinking of it as a thought that's coming, right? It's something that's coming by in front of us. Do we accept it or not? That choice is ours. So in ACT we are basically learning that, we're sort of practicing that, and in that process we use mindfulness is very predominantly used in these therapies. Even in dialectical behavior therapy it is used a lot. I have not spoken about, I'm not speaking about it today because of shortage of time. But when you look at some techniques that is used across all these approaches are body scanning, right? So we are connecting our mind to the body. So a lot of JPMR, muscle relaxation, just focusing on our body, focusing on each part of our body. That is something that's used in all most of the techniques. Again, thought labeling, right? So here we are labeling the thought, whether it's a fact or is it is something in passing. That decreases the fusion and promotes observation, right? The second we become inquisitive of our thought, positive or negative, immediately the thought loses that that suspense. That's what I tell my students, right? The second you question the thought that you are having, the intensity of that immediately reduces, right? If the thought comes in that I am a failure, if you immediately respond and believe it, it is going to have more power over you. But the second you question, ask why do I think I'm a failure, immediately there is nowhere to go, right? There is no fact to tell that you're a failure. Maybe the thought came in because one time you failed an exam, or the thought. So immediately when we question that thought or label the thought, we are decreasing the fusion and we promote observation, right? Again, grounding techniques to manage anxiety and disassociation, and the urge surfing, right? Tolerating discomfort and delays the reaction. So urge surfing is very commonly that we use in for substance abuse cases. Again, loving kindness meditation. So a lot of affirmation based, or a lot of positive affirmation or confirmation, those to increase self compassion, and leaves on a stream, right? To again reduce over identification of thoughts, right? So these are some techniques that are commonly used in in these therapeutic models. So you can obviously read more about these. There is a lot of books written about it, a lot of research papers that have been written about this, so that really helps us to have more techniques in our umbrella, right? Because each child that we work with is different. Maybe say body scan might work with one child, but then with the other child, the child is like, I don't want to sit and do JPMR, right? I can give my own example. I think when I was in class I would refuse to do JPMR because I didn't like how my body felt, right? But I really enjoyed techniques where I had to write, I had to express through art. That was something that worked better with me. But techniques like JPMR or meditation, all of that did not work with me because I felt it just didn't work, right? Maybe now in hindsight, as I've become a therapist, now I can see that, I'm able to again use that in my practice. But when I was in college, it was never work, right? And only art based, or techniques like art related, or drawing, painting, only those kind of techniques work. So it's very important to notice what our student or what our client is responding to, right? So having that very open mindedness when we are approaching these techniques. So what are the, now we'll come back to the school setup, right? What are the benefits of mindfulness in the school, right? So it reduces the stress, anxiety, and a lot of disruptive behavior, right? So, and it also improves the concentration, memory, and self regulation of the child. It fosters empathy, kindness, and emotional resilience, and strengthens the student counselor rapport. Right. So when we again are teaching this to the child, to our students, even if it can be even in a behavior therapeutic setting, right? It does not necessarily have to be in the counseling. Even for students who are showing a lot of disruptive, a lot of maladaptive behavior in the classroom, by using techniques like this, we are also helping the child, bringing them into the present moment. We are helping them to regulate themselves, right? Or at least in the process they are able to learn to regulate themselves. So a lot of research has been done on how mindfulness has helped or is helping students. So we can notice that there's a lot of improved cognitive performance and emotional functioning, and also reduces a lot of behavioral referrals, right? And it also increases classroom management. So one thing that I have noticed is, I think when I was working in a school 2 years back, um, I had a class that the we had to do like a behavior modification or behavior management, because the whole class was very unruly, especially after the lunch break, right? So the teachers tried everything. They tried showing videos, they tried calming the students down, but it never really helped, right? Because what we noticed, I noticed through observation later, was post lunch the students were very you know they just wanted to go back home. So they were very bored, they were very irritated, right? So and they were experiencing that they were not able to regulate themselves because they were very young children. So they just wanted to go home because they had just finished from UKG and come to first grade, right? So in the UKG they were used to going back home half a day, but when they came to first standard, suddenly they had to sit in class post the lunch break, right? So they were just basically going through that change where they had to adjust to this new setup. And because of that there was a lot of anxiety, right? Some kids were like, no, but this is my sleeping time, why should I sit in class, right? Because for 3-4 years before that they were going home, right? So there was a lot of anxiety, there's a lot of irritation around it. And when we introduce mindful practices, right, I think I started making them doing like basic like breathing exercises with like very calm music in the back, right? For 15 minutes I would do that with the students, sort of regulate their emotions. And then immediately what we noticed, and again obviously in the first week nothing happened, they were still chaotic, they would keep making noise and causing a lot of chaos. But through I think 3 to 4 weeks after that, immediately I noticed that they were able to calm down, right? They were looking forward to that 15 minutes of that guided meditation or breathing. That immediately post that they would be like, okay, now this is something, and immediately their nervous systems calm down. And by the, I think, the month or 2 months into this, they were able to stay in the class, and the sort of disruptive behavior reduced. So finding ways to inculcate this again at a very age based practice, but being able to do it, but again accepting their behavior as it is, but also inculcating it as a practice in their day to day lives. So when we look at, I have made some age appropriate mindfulness techniques that we can use. There are a lot of techniques available, and I think if we also sit and look at our classes, we can come up with our own ideas by mixing 2 3 techniques together or something like that. So for primary students generally, a lot of bubble breathing, right? So asking them to suck the air in and then letting it out, right? A lot of glitter jar activities for calming, right? So basically they're looking at something that's very sensorily, that's very pleasing or very calm. And a lot of animal breathing, because if we tell them to just directly take a deep breath in, deep breath out, they generally will not go for that. they'll do it for two times. Either they will breathe in too hard, or then they will breathe out very fast, because they're not able to hold their breath like how adults do. So we can maybe make it like like animal sounds, right? We're going to breathe like a bunny, so we can maybe keep bunny ears and make them do the same deep breathing, but we are just using different techniques to make it more playful for the students. And we also we can use certain videos, sounds of birds, sounds of, we can either make them listen in their own classroom, make them all keep quiet and ask them what are the different things you hear, or we can make them all go quiet and close their eyes, and we can play certain sounds, maybe the sound of a cat mewing or a dog barking, and we can ask them what is the sound that you heard. So maybe that is also something that we can use to for the primary school students. For middle age school students, we can use body scans, we can use progressive muscle relaxation. There's one particular technique that I there's no formal name for it, but this was something I learned in my school, where it was like we are basically having this white light, right? So that we are sort of bringing that, it was basically muscle relaxation, or like a body scan, but then they made it very innovative in terms of like a white light that's sort of coming in from the sky, right? So the sky that's filled with clouds, that the white light is coming from the clouds, and it's going in from your head, and it's going into your forehead, and then it's covering your eyes, then your nose, and your it's coming down, and we sort of go through the body, and then the white light goes out and spreads into the school setup and then the world. So it was basically body scan, but then it was just worded a little more, I would say, child friendly way. And that was something again really helps. So we can do something like that, right, where it is more interesting for the students. And we can also teach them muscle relaxation, where it is something that's practiced every day, right? And also, towards the end of the school day, journaling three things that they've noticed, right? And that shouldn't be the same thing that they have noticed, right? It should be three things that is new every day. So they are more conscious when they are going through their day-to-day life. They are more conscious of what are the three, to find three new things, right? Because if it's the same thing, then they'll write bench, chair, blackboard. Shouldn't be the same thing. Should be three new things that they've noticed every day. Mindful walking, and also anchoring to their senses. So a lot of sensory activities, the 5 4 3 2 1, all of that is something that we can inculcate in their day-to-day life, right? And these are all things, at least body scan or JPMR will take at least 15 to 20 minutes, but the other things we can start off, it will only take 5 minutes, right? So if this is something that we can make a deal with the teacher, that maybe we can inculcate this towards the end of the day, so students are more mindful about what they're doing in the school setup, right? So this is one thing that is more time friendly. And when for high school students, obviously a lot of guided meditation, or if they have apps and access to apps, there are a lot of timer apps and a lot of apps that focus on guided meditation. But I also feel like there are a lot of videos on YouTube that we can find for students, that has a lot of guided meditation, which is again available for free, right? So if this is something that they can use in their day-to-day life, again a lot of guided practices, and a lot of 5 4 3 2 1 grounding, and the CBT integrated mindful self-talk, right? So here again, when we talk about CBT integrated mindful self-talk, it is basically detaching from the thought, that and looking at the thought from an objective way, and then having the mindfulness self-talk, right? So Yashasvi, no dear, the PPT will not be shared, but if you have any questions, you can reach out to me, since you are part of the team. So yeah, so this is another technique that can be used with the students, right? So into our counseling session, into our one-to-one or our group counseling sessions, I feel this is where again, when we're doing it in a class setup, when we're doing it in a group setup like that, it is something that we are teaching the students to practice also in their day-to-day lives, right? So they can go back home and do this as well. If we have time in the school, we can do it in the school timings as well. And this is something that they learn for life, right? So even in the future, when they've grown up as adults, they can use these techniques when they are feeling stressed out or feeling overwhelmed. And in the counseling session, how can we use mindfulness, right? So starting or ending the session with a brief grounding activity. Again, I think I gave the example earlier, that if a student is coming to you after the lunch break, they might have had so many experiences through the day that when they come and sit with you, they just, someone to vent out. So immediately they come and sit and vent out. And it might help for that moment, but if the child is doing that every session, you're not really focusing, not able to come to the part where the student, why the student is actually there, right, for their particular whatever goals you set for the child. Because the child is just coming and using that 1 hour to talk about whatever happened in their day, or to just gossip, or just tell about their friends and some inconveniences that has happened. So when we ground them, when we use grounding techniques at the start of the session, we are able to, one, bring them to the present moment, and then we are able to, I think, move the session a little more, in a more present manner. Right? I just feel like there is some difference that is there when you start with the grounding activity, because then, especially if it's a first session or something like that, then again, when they're grounded, they feel a little more calm, right? They might be nervous because, say, someone, if the student has been sent to you by the teacher or by the principal, the student is already anxious as to what this person is going to do, right? By the person, I mean the counselor, right? So to when we start with grounding, what happens is we are able to calm the child down a little bit, to calm their nervous system, and then we are able to meet them at a space where they're not so overwhelmed. Maybe if the overwhelm is coming from like a 6 to like a 4, right? So starting or even ending the session, again, ending the session with brief, with like a grounding activity, if they have sort of discussed something that's very overwhelming, or there's a sort of catharsis that's happened, and say they have to go back to the class, right? If we do not calm their nervous system by doing some grounding activity, they're going to go back into, say, that space of a classroom where they're already overwhelmed from here, and then going back to the classroom. So the nervous system will, I think, just go out of wire. So every time you start or end the session, always time a 5 minute at the start and 5 minute at the end for a grounding activity. Whatever you can have, like a, and I think having a pool or having a database of these activities help in a school setup, because then you can just go to your, like, your folder or something like that, and just pull up an activity and do it with the child, right? Rather than thinking about it during the session, if you plan it in a certain way, then I think it really helps benefit the child, and also benefits the nervous system that the child is coming to you with, right? Also, using mindfulness to manage session transition or emotional escalation, especially when they're discussing something too overwhelming or traumatic, at that point, to use mindfulness so that they are not too overwhelmed by the topic that they are discussing. And also introducing it as a part of goal setting, or as part of the self awareness exercise, right? So when we are looking at goal setting, when we look at kids, it's much more easier. But when you're working with adults, right, what I've noticed is, when you ask them, like, why have you come to therapy, what is your, do you have some particular things that you want to work with, immediately there'll be one, like, list of things that they want to work with, right? So then they start getting over, like, I want to work on this, I want to work on this, oh wait, I want to work on this also. So they'll name me like 10 things at a go. And as a therapist, you know that you can't work with all the 10 things at once, right? So then, if you introduce mindfulness and ask them, like, if intentionally, if you have to pick two things from this list of 10 things, what would that be, right? So then we are intentionally bringing them to the present, and then we are able to get that clarity from them, so they are also not overwhelmed by the therapeutic process, and you are also giving them that space, right? And also to normalize pauses and silence in session, I think this is very important, right? Especially with kids, there is going to be a lot of pauses, lot of silences. So how do we navigate that if we as a therapist are uncomfortable with their silence, because that is again a space where they are bringing themselves to the present, right? The second, when there is uncomfortable pause and you speak up, immediately you are also dysregulated, and the child also feels that sense of like hurry, right? So, but when we pause and we are like, okay, you sit in the session, don't have to speak anything, just sit, and then that silence, that when they are able to sit in silence with you comfortably, I think that again is a sense where mindfulness really helps, right? um, and what are some practical tips, right? Because I do understand that when we look at mindfulness, it's a very tricky thing to bring up in session, because suddenly if the client or if the student is uncomfortable, they will find ways to push when there is resistance, especially they will sort of either not speak at all, and then they'll be like, I don't want to do this, right, because I'm not feeling comfortable doing it. So a lot of resistance also might come up, right? So frame it as a tool, right? So when we are looking at it, to be like, let us try this, right? Let us try this particular thing and see how you feel, right? If you don't feel good, it's okay, we'll do something else, or we'll do this some other day, but let us try it. But rather than be like, no, you have to do it, for your mental health, like how people sort of force yoga and meditation, not forcing that into you, but rather than being like, hey, let's try it. So bringing that curiosity with it, right? Or just telling them to sit with that thought. So whether they want to do it or not, that is up to them, but giving them that option as to yes or no, right? And again, don't enforce it, but rather invite. So offer options, right? So if this is not something you would like to try, can we try something else to make you feel calm? Or we can ask the student itself, right? Right now I know that you're not feeling calm, is there something that you would like me to do, right? If they are refusing to do what you are asking them to, ask them what might help them right now at that particular point, right? So whatever is happening, even if you're working with students, adults, I think, is to give the other person, that is your client, the space to be who they want to be, right? That unconditional positive regard is very, very important when we are looking at our counseling, right? And hopefully in that, mindfulness is something that we can integrate. And before we sort of, I think I've not made a PPT on this, but I think when we are looking at these techniques, we are looking at these interventions, it is not just for the student or for the client, but also something that I think as therapists we have to practice very, very diligently. I think we are in a profession, we are in a very noble profession, where we have to have a very regulated nervous system. I learned it the hard way. And I think in supervision I had also learned that gen working as a school counselor, working in this field, the why people come to us is because of our nervous system, right? And we are also human, right? Our nervous system also will, we also have a personal life, we also have our own, things to sort out. So generally what will happen is, sometimes when our nervous system is not in par, or is not at a homeostasis, sometimes we might also feel overwhelmed, we might also feel burnout, we might also feel compassion fatigue, right? So making sure that we do not go to that point where we feel burnout or compassion fatigue, but constantly questioning, constantly keeping our mental health, keeping our nervous system in loop as to how we are feeling, right? So that we are able to give back to our clients, we are able to give back to our students, and we are able to be present, is what the goal should be, right? So hopefully by, I think this is a very brief webinar, where I try to cover so much about mindfulness. But then I am someone who really, I wouldn't say love mindfulness, because that sounds very cheesy, but I think it is something that has really helped in my practice with students, with adults. And I think, while we are also going through our practice, I hope some of the techniques that I've discussed might help. um, uh, if we have any questions, you can put it in the chat. There are a lot of resources also available online for students. I had one PDF that I wanted to share, but I don't think I have the time right now. So it has a few activities with for students. If maybe you can reach out to me, or on the group, WhatsApp group, if you're all part of that, I think I can just share that PDF on the group. It has, I think, bunch of activities which really helped me when I worked as a school counselor, right, for my practice. So I can just share that PDF maybe on that group, and we can all access that. But if we have any questions, you can unmute yourselves and ask me, or you can put it in the chat as well. I'm open to not just questions, but any discussion points, anything is there, you can put it. I'll just give like a few minutes for that. Thank you so much for listening to my webinar. If you have any questions, you can put it. I think we'll open the uh, space for questions. Okay, I think we can, I think, wrap up. You obviously, if you are on touch with me on WhatsApp, you can message me the questions as well. I'm open to conversation, discussions, anything. Thank you, Deepthi. Thank you, Nakul. So like, hopefully we can stay in touch. Any questions, you can reach out to me on WhatsApp. I think for now we will stop the presentation. Thank you everyone for giving me your time and listening to me so patiently. um, have a good day, everyone.